Pulse pressure is found by the systolic pressure minus the diastolic pressure. A normal blood pressure is going to have about a 40 millimeters of mercury for the pulse pressure. A person might have a pulse pressure greater than 50, and it be seen as normal under some certain circumstances, such as pregnancy, a fever, exercise. Anytime your blood pressure goes up, you're probably going to have an increased pulse pressure, so exercise would increase your blood pressure, so that kind of explains that one. Anxiety, and anemia. Abnormal reasons why the pulse pressure would be high would be an increased intracranial pressure. Intracranial pressure is saying in the cranium, inside of the cranium, you have an increased pressure, and that could be caused by several factors, but a very common one would be a head injury or a bleeding stroke. Because compliance decreases with age, let's look at compliance again. Compliance decreases with age. What is compliance? Compliance is the stretch of the blood vessel wall. So remember, your vein here would stretch. Okay, it's not going to be able to stretch as much with age, so it's going to be thinner here, which is going to send more blood to the heart, and that's going to give the heart a higher blood pressure. Pulse pressure, because of that higher blood pressure, pulse pressure will usually increase with age also. Okay, pulse pressure, remember that the pressure is determined in the elastic arteries. So if you look at the pulse pressure and subtract the diastolic from the systolic pressure, you get the pulse pressure, and the pulse pressure is going to travel along the elastic arteries, and you're able to feel the pulse pressure. And we call that a pulse. You're able to feel your pulse in several places on your body. You're able to feel the pulse anywhere an elastic artery is close to the surface. So let's make a list of those areas. First, you have the superficial temporal artery. The superficial temporal artery would be on the side of the head, on the lateral side of the head. The common carotid artery. The common carotid artery is in the neck. The facial artery. The facial artery is along the mandible. The axillary artery. This would be in the armpit. The brachial artery. This would be in the elbow. The radial artery is going to be in the wrist. The femoral artery, that would be in the hip. The popliteal artery, that would be behind the knee. The dorsalis pedis, that would be on top of the foot. And the posterior tibial would be on the back portion of the ankle. So those are all the locations that you can feel the pulse pressure.